Hi, I'm Dr. Jim Hoven. Welcome back to our first official episode of Health Matters. I am so excited. We've been looking forward to giving this information to you for so long, and now it's finally here. So here's what we're gonna do. Today, we're gonna talk about one of the most common injuries that people experience after a traumatic event, whether that be a car accident, a slip and fall, any kind of major injury. This is oftentimes involved. And what is it? It's the neck. Now, what I have here is a spine, and I'm gonna show you some anatomy here. We're gonna go through some basic injuries, but first it's important that you see exactly how the spine lays out, specifically in the neck. If we're looking at your spine, from the front it should be straight, and the neck is made up of 7 vertebrae. Starts here, goes to here, and then your brain would sit right here. If we turn the spine to the side, this neck should have a normal curve that's kind of curved from top to bottom that curves to the front like this. Now, for anatomical sake, here's what you need to know. There are 7 bones in here, and each bone is separated by one of these discs, and you can see them right here, and those are critically important. You know why? Because they're separators. They're separators of these little nerves that come out. Now, the nerves, you'll notice, they come all the way down the spine, but when we're talking about the neck, they go to the body, out to your arms and hands and fingers. They go to the face and your skin of your scalp, but they go back to the brain. And if these things get damaged, you can imagine how the brain's not going to be able to talk very well to the exterior part of the arms and legs and even up into the upper part of the trunk. So really important that this stuff stays healthy. Now, what happens when you get in a car crash or when you slip and fall or you get a sports injury, somewhere your head snaps around? These ligaments, there's all kinds of ligaments around these bones that are not shown on this model, but those ligaments are like, think of plastic bags. When those plastic bags get stretched, do they come back like a rubber band? No, right? They stay stretched. That's a ligamentous injury. And so imagine your head going forward and back really quickly from a trauma. Those ligaments can get stretched, sprained is what it's called, and it can cause all kinds of swelling. Well, when the swelling happens, the muscles around here go into big spasms. They try to hold you and guard you, but that then causes its own pain, puts pressure on these nerves, and doesn't allow the neck to move right. So, when you get into any injury, it's key, absolutely critical that you find providers that know how to take care of a trauma-based neck injury. Those are people like your medical doctor, your chiropractor, even skilled massage therapists and physical therapists. They're all going to work together in order to help rebalance or to relax the muscle, to get the spinal joints back moving again, and to allow the swelling to come down and normal motion to return. If you can get those few components back together or back in line, then you're going to take pressure off the nerves, you're going to help the spine to get back to a normal biomechanical movement, and you're going to help the brain to be able to talk correctly to the body. So that's a quick summary of what we want to do should you get in any kind of trauma that involves your neck. The typical diagnosis that you would hear is sprain strain, like you sprain an ankle, where the muscles get torn to some degree, the joints get sprained like a sprained ankle, and so then the treatment becomes working on those types of maneuvers, right? Whether it be, again, chiropractic, massage, and some medication to help with the swelling. If things get more serious, that's a disc injury. So if one of these discs actually starts coming out of the space, if it starts bulging, then that's where you might need things like injections to help reduce the inflammation, steroids, or in a worst case scenario, it could require a surgery to help stabilize or restore proper function of the neck. So ideally, you go from more conservative treatment for less damaging diagnosis to more aggressive treatment for non-responsive or more severe injuries. So again, the most common injuries, sprain strain of the neck, where the muscles and the ligaments and the joints all need time to heal, and then that's what you're going to get treated with more conservative care and some easy medication. So let that be your guide, that if you've been in an accident or injury, those are the things to look for from your providers and in your treatment. Of course, if you have any questions, please let me know. You can find me at jim@ramoslaw.com. Ask me questions about your neck, and I'm happy to answer those for you. So until our next episode, stay healthy and remember, your health matters.